Hello, this is Dr. Michael Worley, and I just wanted to show you a locator case that we did last week. And in this particular case, we're going to utilize the patient's old partials as temporaries. This is what she looks like when she comes in. She's got bad perio, and you can't see underneath there, but she's got several abscesses. I'm not a fan of working in infected areas, so I always think take out the teeth that are abscessed and try and leave some sort of temporary where the patient's going to be happy. There's both sides, not looking any better. This is what it looks like on the CBCT. And this is our virtual placement on the right side and the left side of for the implants. This patient we discussed doing All-on-X, but she just couldn't afford it financially, so she wanted to go with Locator. All right, so here is a virtual demonstration of where we're going to go with the implants. As you can see, even some of the teeth that I end up saving, it looks like they may have some abscesses around them. I'm going to try and keep these things to survive because otherwise she's going to be miserable for the next 3 months. And if I have to move quicker because she starts to abscess or has problems, then I will do just that. What you're looking at here is a decent AP spread is the main thing. Plenty of length because locators don't take that much anchorage because they don't need that much. Some have many forces on them. So this is a nice little layout for this particular case. In this, you're going to notice that 3 of these, number 7, 22, and 28, are going to be immediates. This is what the lower looked like after she came in the second appointment, and we prepped the teeth for a temporary. We're going to seat the temporary in here. We already had this milled because I have a lab in my own house, and we're going to go ahead and put the lower partial on around that. And the upper, we took off all the teeth except the canines, and because that's what the upper partial attaches to. We relined the upper partial and added a wrought wire to it. Actually, she was missing a wire, so that's actually better than it was before. All right, so here's the mandible. You can see I've got all 4 of the implants in there. It started out with a guide pin shot in a pretty decent location. I'll be using Blue Sky Bio in this particular case. And there I am putting the implant back there at number 19. This is the immediate site of number 22. I'm going to prep it out there first, as I always do, create my osteotomy. And I used VersaBurrs after I used the initial Blue Sky Bio burr. Pack the entire thing with bone graft, then use a VersaBurr, slow dry in reverse, put the implant in, and it's settled in there quite nicely, staying well away from the buccal, of course. This is what it looks like after the patient's been sutured back up, and we've got the implants in place, and we kept them really low, right at the tissue level, so we could put the temporary back over it. This is the upper implants in place. Again, we sutured those all the way down, and put the upper partial back in there. This is what the upper implants look like. They're all in bone very nicely, and they all line up pretty decent, actually, in the mouth, as you saw with the guide pin shot. There's the lower ones. They also line up there very nicely. And there's the final representation. So we're going to keep those buried, come back and do second phase surgery in 3 months. And then we're going to do an immediate locator case, basically creating the 2 overdentures and then extracting these last few remaining teeth the same time we deliver the overdenture. Of course, we'll have to do a reline about 6 weeks after that. But in this particular case, this made the patient very happy because they didn't have to lose their partials, which they were still able to function with. And it made me happy because I get to place my implants and get them buried so that I don't have any forces on them while they're healing. I'm a fan of that for locators. Very good. All right. That's the presentation, at least for now. 3 months from now, we'll get her back in and actually do the overdentures. I hope you liked the case. If you did, feel free to like, follow, or share it. And if you have any questions or comments, feel free to shoot me those too. Thank you very much. Goodbye.